physical and cognitive development in late adulthood. Old age is still a time of potential. Elderly with a positive attitude and who look at the glass as half full instead of half empty live longer. Those who agree that things get better with age generally live 7.5 years longer than those who buy into the negative stereotypes of aging and have a defeating perception of self. This optimistic attitude advantage persisted even after controlling for certain factors like physical health, SES, gender, and loneliness. Elderly who are more educated are less likely to buy the negative stereotypes uncritically. In 1900, 1 out of 20 Americans were over 65 years old. In 2000, 1 out of 8 Americans were over 65. That is 35 million in 2000. In 2030, 1 out of every 5 Americans will be over 65, which is 4 times the proportion of elderly in 1930, 100 years previously. The baby boom generation was born between 1946 and 1964. There are 76 million there. Gender gap exists. At age 85, for every 100 women, there are only 41 men. There are stereotypes of the aging, just like there are stereotypes of adolescence. And these stereotypes are just as faulty. Those over 65 years old are not mentally challenged and cognitively deficient. They are not more unhappy and possess poor coping skills. They are not preoccupied with their aches and pains, lonely, and without sex. In fact, older folks are quite cognitively present, though a bit slower. They experience fewer negative emotions than younger folks and are more accepting of aches and pains as part of the natural course of life. They are not lonely, but selectively choose to hang more with family and close friends rather than socializing with relative strangers. And they are as sexually active at age 71 as they were at age 46. Life expectancy jumped forward more in the last century than in the 5,000 years that preceded it. Women live an average of 4 to 7 years longer than men do, and it is suggested that the extra X chromosome protects somehow. Genes play a role. Those who live to 100 years old have longevity-enabling genes which seem to limit the destruction of free radicals. These centenarians have abnormally high levels of HDLs, the good cholesterol, which helps coronary arteries stay freer of fat. Other factors that give someone an edge on living longer are education and income. As the latter go up, so does longevity. By 2020, the proportion of elderly over 85 will double, and by the year 2050 it will quadruple. This is according to the U.S. Census Bureau of 2006. Chances of living to 90 or 100 are twice as high for those whose own parents lived to 70 years or older. The oldest on record lived to be 122 years old. By age 80 years, the brain has shrunk by 5 to 10%. The cerebellum takes a heavy hit by losing 25% of its neurons. This is the brain structure responsible for coordination and balance. But there is some plasticity, and other neurons grow more synaptic fibers to take over the jobs of the degenerated neurons. Besides these changes in the central nervous system, the autonomic nervous system performs less well. The autonomic nervous system increases the level of stress hormones, thus contributing to sleep and immunity problems. Higher levels of stress hormones rev up the central nervous system. In late adulthood, 7 hours of sleep are still needed. The elderly have more trouble falling asleep, staying asleep, or sleeping soundly. 20 to 40% have insomnia a few nights a month. To combat sleep problems, the elderly should establish a regular bedtime and arousal time, exercise regularly, and use the bed only for sleeping and not reading or television. With age also come more problems with medication side effects. Drugs may interact or exacerbate or intensify certain medical symptoms. Falling may be more problematic. The elderly need lower doses than normal adult dosages because their livers do not break down medicines as well, and their kidneys do not excrete them as well. Besides the problems with liver and kidneys, the brain and nervous system become more sensitive to certain medicines as we get older. Thus, medication side effects are more prevalent. The elderly comprise 13% of the population, but account for a third of all prescription use. The elderly have a harder time dealing with temperature changes and dealing with extremes in cold and in heat. They sweat less in heat and do not as easily raise their core temperature in cold. All of these changes are mild in physically fit elderly who are healthy. Reproductive organs have little change, and sex is still engaged in by couples, though not as intensely or as frequently. Influential is past history of good sex, as this impacts good sex later. Women continue to hold context, that whole picture, including expressions of love and intimacy, touching, hugging, and cuddling from their partners. Women continue to hold context as important elements in their sexual desire. Men's sexual desire puts less emphasis on context and more on spontaneity. As we age, there are more losses of sight, hearing, taste, and motion, and more chance of having a major medical condition. There are more friends and relatives lost to death. And there is discrimination based on false stereotypes. Doctors are less enthusiastic to treat the problems of the aged, or they are more blasé about an illness. Certain complaints are taken lightly as a natural expectation of growing old. Employers are less willing to hire the elderly. The reasons elderly have vision problems are less light reaching the retina due to scattering and to loss of cells in the retina and optic nerve. Binocular vision, or using both eyes for visual images, declines, making depth perception more iffy. Visual acuity, or sharpness of vision, drops radically after age 70 years. Dark adaptation is compromised, making it harder for the elderly to adjust to a dark movie theater from a lighted lobby. Two conditions of the eye associated with age are cataracts and glaucoma. Neither causes the other. Glaucoma was covered under physical development in middle adulthood. It involves poor eye fluid drainage that builds pressure, damages the optic nerve, and leads to blindness if not treated. A cataract is a clouding of the lens. The lens, made of water and protein, is clear and lets light pass through it. With age, some of the protein may clump and cloud a small area of the lens. Over time, this cloudy cataract may grow larger. surgery is common and highly successful in restoring sight. Still, a third condition of the eye that plagues the elderly is macular degeneration. The macula is the center of the retina. If light-sensitive cells are lost there, vision blurs and leads to blindness if not treated. Laser therapy has had success. Vision problems in late adulthood are more prevalent in smokers. Heredity plays a role, and so does atherosclerosis, which reduces blood flow to the retina. To protect against vision problems longer, adults should eat a diet rich in vitamins A, C, and E, found in green leafy vegetables. Carotenoids found in vegetables with yellow and red pigments have protective value as well for vision. The majority of those aged 85 and over do not suffer with vision deficits that interfere with daily life. Hearing deficits are greatest at high frequencies and low decibel levels of soft sounds. Blood flow to the ear structures is less. The eardrum is stiffer, and the inner ear and auditory cortex have fewer cells. Hearing loss can be a very lonely condition as the elderly feel left out of the loop. People become annoyed at having to repeat so much, so that the elderly with hearing loss tend to feel isolated. As for taste and smell, the elderly have less sensitivity to taste and odor and less enjoyment of food. The elderly have less sensitivity to touch in the fingertips after age 70 years. With age, the cardiovascular system and the heart are affected in many ways. There is more rigidity in the muscle, less responsiveness, enlarged cells, deteriorated cells, and a thickened left ventricle, the largest chamber pumping blood to the body. Artery walls may be stiff and clogged with plaque made of fat and cholesterol. All of this means heart rate is decreased and the heart pumps less forcefully. With a slowed blood flow in the circulatory system, there is not enough oxygen available during physical exertion. The respiratory system is compromised further, decreasing the amount of available oxygen. By the age of 80 years, the amount of air that can be moved in and out of the lungs is decreased by 50%. Lung tissue is not as elastic, so the lungs are not filling and emptying as efficiently. Less oxygen is placed into the blood and less carbon dioxide is removed. With aging of the immune system, T cells do not operate as efficiently in attacking antigens. The immune system may even turn on itself and attack normal tissue in an autoimmune response. Rheumatoid arthritis and diabetes are autoimmune diseases. Those elderly who are the most physically fit have the least problems with a declining immune system. Optimism is so important in old age as it translates into more effective coping with the physical limitations that old age brings. Only the strongest of men survive past 85 years and are less physically impaired than women who also survive. Those adults who exercised throughout life, did not smoke, and did not become obese are more likely to age without disabilities. They will enjoy more compression of morbidity with far less debilitating health preceding death. This means living until they die without loss of function, compression of morbidity. As for nutrition, people in late adulthood need more calcium and vitamin D for bones, zinc, vitamins B, C, and E for the immune system, vitamins A, C, and E to protect against free radicals. Free radicals are unstable oxygen molecules which damage cells and figure prominently in age-related diseases. More free radicals are produced the older we get. Antioxidants include vitamins A, C, and E, bind with free radicals to prevent their damage march. Diets rich in antioxidants are recommended for all, but even more so for the elderly. Eat plenty of colorful fruits and vegetables like berries, tomatoes, spinach, broccoli, red grapes, and carrots, plus garlic, tea, soy, beans, fish, poultry, and whole grains. Eat nuts and flaxseed. Red wine and dark chocolate also are rich in antioxidants. A caution is that too many calories increase the amount of free radicals, so you have to watch the calorie intake. Since daily diets do not provide for vitamins adequately, the elderly should take a daily multivitamin and mineral pill. Research has shown that daily vitamin pills reduce sick days by 1/2. Exercise increases the vital capacity, or the amount of air lungs can move in and out. Exercise strengthens muscles to improve walking and balance and everyday activities. Exercise increases blood circulation to the brain, which aids in attention. 6 pounds of muscle are lost for every decade in mid and late adulthood. This muscle loss happens along with an increase in body fat, setting the stage for age-related disease. Strength training 20 minutes a day, 2 or 3 times a week, can rebuild 3 pounds of muscle and increase metabolism by 7%. Fringe benefits include reduced blood pressure, increased bone density, better sugar metabolism, and gastrointestinal functioning. Regular physical exercise, like aerobic exercise, 30 minutes 3 times a week, also does wonders. It reduces the risk of Alzheimer's by 60%, reduces depression and inflammation. Such dramatic benefits of strength training or aerobic exercise are suggested to be caused by the enhanced function of the cell's mitochondria. Mitochondria are structures we all inherit from our mothers, which use oxygen to produce the chemical energy every cell needs to function. Mitochondria leave oxidants as byproducts of their work, which can damage DNA. But exercise tends to enhance the function of the mitochondria without the byproducts as being as evident. Exercise may also be instrumental in reducing the shrinking of telomeres, the end sections of chromosomes that degrade with cell division and age. 75 to 80% of elderly do not exercise enough, but it is never too late to begin. Cardiovascular disease and cancer are the 2 biggest killers of the elderly. Next comes respiratory disease, in particularly the 50 lung inflammations known collectively as pneumonia. In old age, adults should be vaccinated against the most common type of pneumonia. 4th on the list of killers is stroke. This brain hemorrhage blocks brain blood flow. All 4 of these health conditions are related to age but not caused by age. Primary aging is biological aging and affects everybody, even healthy people. Secondary aging is aging induced by hereditary defects and environmental insults and bad choices concerning diet, exercise, substance abuse, pollution, and stress. Frailty and physical disability in the elderly include arthritis, diabetes, unintentional injuries, and osteoporosis. Arthritis is of two major varieties, osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common and describes the painful condition resulting from the deterioration of cartilage on the ends of the bones in joints used most often. Wear and tear on the cartilage prevents the cartilage from doing its appointed task of cushioning the bones during movements. Rheumatoid arthritis is an autoimmune disorder that inflames tissues that connects joints throughout the body, not just joints used the most. Diabetes is a metabolic disease featuring abnormally high glucose or blood sugar, called hyperglycemia. Glucose is released after meals once the food is broken down. Cell activity depends on glucose for its source of energy. To keep levels of glucose optimal, the pancreas secretes insulin to trigger muscle and fat cells to absorb it from the blood. When there is not enough insulin, or when body cells begin not responding appropriately to insulin, adult-onset diabetes or diabetes mellitus occurs. Eventually, blood vessels are damaged by the high levels of glucose, and circulatory problems in the legs, heart attacks, strokes, blindness, kidney damage, nerve damage, and Alzheimer's disease become more probable. Diabetes can be inherited, but a sedentary lifestyle along with abdominal fat increase the risks. The characteristic symptoms of diabetes are excessive urination, excessive thirst, and increased drinking to compensate for all the peeing, blurred vision, unexplained weight loss, and lethargy. The most frequent unintentional injuries of the elderly are car accidents and falls. Old agers do not speed, but they are not attentive of signs, and they make turns inappropriately. Slow reaction and indecisiveness at busy intersections can be risky. Having weakened bones and not being as able to break a fall, the elderly seriously injure themselves with a fall, much more so than with falls at earlier ages. Broken hips are the most serious, and half of the victims never learn to walk again without appliances. Osteoporosis is severe age-related bone loss that skyrockets the risk of bone fractures. It affects the majority of those over 70 years old of both genders. Women lose 50% of their bone density in mid and late adulthood, half of this in the first 10 years after menopause and the end of estrogen release. Men have a more gradual decrease in testosterone release and bone density loss. Risk factors for osteoporosis include heredity and thin, small frames which did not reach a high peak bone mass in adolescence. Other risk factors include physical inactivity, deficient calcium and vitamin D to absorb the calcium, smoking, alcohol, too much salt which depletes calcium levels, carbonated drinks containing phosphoric acid which increases the excreting of calcium in the urine, and caffeine which drains calcium from the bones. It helps to eat a diet that's low in salt and rich in protein, calcium, vitamin D, minimally processed whole grains, and fresh fruits and vegetables. Be sure to limit caffeine and carbonated drinks. Potassium-rich foods such as bananas, tomatoes, and orange juice may help decrease the loss of calcium. 10 to 20% of osteoporosis victims die within a year of a broken hip. The rates are 2 times higher for men, as men are often overlooked for osteoporosis and do not receive interventions to prevent bone density loss. Women who have extra weight appear to be protected somewhat from hip fractures and osteoporosis. There are two main categories of cognitive disorders in late life: dementia and delirium. Dementia is deterioration of mental faculties like memory, abstract thought, judgment, impulse control, language, and intellect. The downgrade interferes with everyday living and changes the personality. Of the many different types of dementia, the most common is Alzheimer's disease. The second most common is vascular dementia. Parkinson's disease is a form of dementia, but unlike Alzheimer's and vascular dementia, which involve cerebral cortex damage and acetylcholine deficits, Parkinson's hits much earlier in life and involves midbrain damage rather than cerebral cortex damage, midbrain damage in the substantia nigra, and dopamine deficits rather than acetylcholine deficits. Alzheimer's disease involves shrinking of cortical tissue and pronounced memory and learning deficits. In the beginning, symptoms may not be noticed. The patient has a harder time concentrating, forgets things, and is irritable. Forgetting recent things is first to show, and then more distant events. Anxiety, social withdrawal, aggression, and depression are not unusual. The symptoms progress to confusion and disorientation, delusions, imaginary fears, and eventually to inability to care for self, to understand or produce speech, coma, and death. Post-mortem, an increase in the number of plaques and neurofibrillary tangles can be found. Plaques are B-amyloid protein deposits found outside of the neurons. They are dense and surrounded by clumps of dead glial cells and nerve cells. Neurofibrillary tangles are protein filaments made mostly of the protein Tau and found inside the neurons. Both plaques and neurofibrillary tangles are found in neurons which use acetylcholine. There are two main types of Alzheimer's. Familial, runs in families and occurs before age 65, and sporadic, doesn't run in families and is later onset. Genetics plays a role in both types. In familial Alzheimer's, genes on chromosomes 1, 14, and or 21 have been implicated in the abnormal production of harmful amyloid protein. This type of Alzheimer's is dominant and only needs the gene from one parent to give familial early onset Alzheimer's to the child. In sporadic Alzheimer's, the E4 allele gene on chromosome number 19 causes too much of a blood protein called ApoE4, which carries cholesterol throughout the body. This adversely affects another gene needed to regulate insulin. When the effect is severe enough, there is too little insulin and too much glucose, resulting in diabetes. Diabetics in late adulthood have a 65% chance of also developing Alzheimer's. Cardiovascular disease, dietary fat, stroke, high levels of bad cholesterol, LDL, head injury, depression. These can all raise the risk of sporadic Alzheimer's. Environment plays a role as evidenced by twin studies with identical twins not sharing Alzheimer's. Environment is also the culprit when elderly without the ApoE4 gene have Alzheimer's, and elderly with the ApoE4 gene do not. Low linguistic ability is a risk factor for the disease of Alzheimer's, and high linguistic ability is a protective factor. Education and an active lifestyle are protective factors as well. Cognitive functioning is preserved with active mental activities which create and reinforce synaptic connections. Drugs that keep acetylcholine around longer in the synapses by delaying its breakdown are used to treat Alzheimer's. Before symptoms are too bad, memory strategies like calendars, lists, and labels can be of help. It is also suggested that word and number puzzles are good therapy. Routine and no sudden changes with furniture and surroundings are helpful hints as well. Like with children, caregivers should distract rather than scold Alzheimer's victims when they ask the same thing over and over. Music is soothing, and slow-paced television programs produced for children are advisable. Vascular dementia is accompanied with neurological signs of arm weakness and abnormal reflexes. Usually there is a history of strokes and atherosclerosis. Smoking, high levels of bad LDL cholesterol, high salt, high alcohol, low protein, and high blood pressure are all risk factors for vascular dementia. Dementia can also be the result of disease and injury. Encephalitis, meningitis, HIV, and syphilis can cause dementia. So can brain tumors, head trauma, substance abuse, and kidney, liver, or endocrine gland problems. Depression can be mistaken for dementia, and side effects from prescription medicines can also mimic dementia. Medicines for diarrhea, vomiting, and coughing inhibit acetylcholine, and they promote Alzheimer-like symptoms. Social isolation and perceived abandonment can produce dementia symptoms too. Delirium is a state of mental confusion, incoherent thought, and rambling speech, disorientation, faulty attention, mood swings, and erratic emotions. The victim of delirium can act restlessly or can be lethargic. Illusions, delusions, hallucinations, and nightmares are common. The sleep cycle is disrupted, with patients wanting to fall asleep in the day and not being able to do so at night. Memory is impaired, especially for recent happenings. Periodically during the day, the victim of delirium will think and act normally. Unlike victims of advanced Alzheimer's who do not have such fluctuations between lucid and disoriented. The victim of delirium may have fever, high blood pressure, increased heart and respiration rates, and loss of bladder and bowel control. Delirium comes about quickly, not gradually. The victim cannot concentrate on what he or she is saying or doing. The elderly and children are prime targets of delirium. The condition is secondary to other medical conditions like malnutrition, dehydration, drug effects, diabetes, thyroid dysfunction, kidney, heart, liver failure, infections like pneumonia or bladder infections, head injury and seizures, and the stress of major surgery. Delirium can be treated and cured if the underlying medical condition is treated and removed. If delirium is misdiagnosed as dementia and not treated, then it can at best result in a cognitive decline, and at worst result in death. Patients with dementia are at a high risk for delirium, but the delirium can be cured if not dismissed as just a progression of dementia. Treatment of delirium includes treating the underlying medical conditions and using antipsychotic medications. Patients can be returned to their pre-delirium states if symptoms are not ignored. Cognitive development in old age is hampered by a decrease in speed of processing. Fluid intelligence, based on 3 stages of memory storage, is more affected than crystallized intelligence, based on experience and culture. To maximize cognitive function, the elderly must practice selective optimization with compensation. They selectively choose those activities deemed more useful and channel their limited energies there. In addition, they make up for deficits by rearranging or shifting emphasis and by using reminders and cues. The text talks of concert pianist Arthur Rubinstein in his 80s, playing the parts preceding fast passages more slowly, so that the perception of speed remained when the fast spots were played a bit slower than when he was younger. He compensated also by selectively choosing only a few preferred pieces to lavishly practice. Using marked calendars, reminder notes, and timed buzzers helped the elderly to optimize with compensation. Deliberate versus automatic memory, recall versus recognition. Deliberate recall is more difficult and more hampered in old age than is automatic recognition. Fluid intelligence deficits include problems with sensory register and taking in information more slowly. It includes problems with short-term memory and being less able to pay attention and filter out irrelevant information. It includes problems with long-term memory and retrieving information due to less usage of memory strategies. So all 3 memory storage systems dealing with explicit memory and conscious memory strategies are compromised. But old-timers are not handicapped when it comes to implicit memory based on familiarity instead. Language processing is closely aligned with memory skills. Language comprehension is more automatic and similar to implicit memory. The elderly can understand what is heard and read with little conscious effort. Language production is more deliberate and similar to explicit memory. The elderly have more retrieval problems evidenced by more tip-of-the-tongue episodes, where the perfect word escapes them for the moment. Wisdom is the fruit of lifelong labor, but it is not automatic, nor is it based on chronological age. Wisdom involves extensive practical knowledge and can be applied creatively. It involves rising above life adversities, not just as a survivor, but as a happy survivor. Emotional maturity, introspective reflection, and true altruistic concern for others are pillars of wisdom. Not all elderly enjoy wisdom, and it is possible for a younger person to have profitably experienced enough to be called wise. Those who engage in public service occupations have more opportunity to develop wisdom. Wisdom is rewarding and lends psychological comfort. Those with wisdom are happier and more content with life and the people in it. To maximize cognitive development in old age, a person must be mentally active all through adulthood. Use it or lose it applies. A person must be physically active as well, as this postpones or prevents age-related diseases which hamper cognitive functioning. Research has proven that adults in old age can enhance their cognitive skills under lab settings. They can also train themselves to enhance cognition and performance in everyday life skills. We are never too old to master complex learning or to enjoy the inherent benefits of new learning. As long as we consider what we are learning to be important, our effectiveness remains. Cognitive declines are far more evident in those elderly who do not remain active mentally or physically and who feel they have lost personal control. Retirement can be positive or negative in its impact on cognition. Leaving a routine, have-to-be-there existence for leisure and stimulation is positive. Leaving a challenging, rewarding career may be negative if challenging, rewarding leisure activities are not substituted. To maximize learning in the elderly, instructors should act as one with them, like a colleague or a peer, rather than an expert. A relaxed pace works best, rather than learning under the constrained pressure of time. Organization is imperative, with outlines and summaries and few digressions from the main topic. Connecting information with already learned information of previous life experiences works optimally. Vibrant stories bring learning to life and make learning effortless. As death becomes more imminent, severe cognitive declines may occur.